It's very hard to give an answer of this is why some people get postnatal depression or why some people don't. And a lot of people spend a lot of time really thinking about why has this happened to me, and it can sap a lot of energy. We can identify lots of different risk factors, but and I'll go through them. But even with that said, some people just develop a postnatal depression. Some of the risk factors are if people have had difficulties with their mood or difficulties with anxiety before, if people are in challenging social circumstances, so maybe they've limited supports around them, maybe they have difficulties with employment or difficulties with housing, maybe they're have come from abroad and they don't have family supports in this country, or they feel isolated or marginalized. And so people with significant social stressors, with significant family problems, with significant previous personal or family history of mental health difficulties are at higher risk of having a depressive episode in the perinatal period. But none of those things mean that you're definitely going to get it. And people can have none of those risk factors and still develop a postnatal depression. Postnatal depression is really treatable, and I think it's really important to emphasize that. I think it's important to get it treated. It's very common, and so some people don't seek treatment because they're worried about the stigma of even just seeking treatment. And I think it's really important to emphasize that there really should be no stigma about this. It's such a common occurrence. There's lots of psychological based treatments, and I think our psychologist Gillian Doyle has highlighted some of them. Maximizing all your social supports and maximizing things like mindfulness, doing activities you enjoy. We've also talked about, and our social worker Stephanie Fogo has talked about some of that. But some people do then need medication in addition to those things. There are lots of different medications that have been proven to be effective, and usually we would start with what we call a selective serotonin reuptake inhibitor, which are the antidepressants that are commonly used. These medications can be chosen from this group that are safe to breastfeed on. So if you're breastfeeding, you don't have to discontinue that. And often these treatments are very effective. If somebody hasn't had a depressive episode in the past, usually people remain on these treatments for a period of months and then can fully come off them. But if somebody's had multiple episodes in the past, they may choose to remain on them for a bit longer. We've talked a lot, and there's a lot of talk in the media about postnatal depression, and people are very familiar with the term. But research from Ireland has shown that you're as likely to become depressed in the antenatal period while you're pregnant as you are after you've delivered. And so sometimes when people become depressed in the before they've delivered, they think that's really unusual, or they're very worried that something is very wrong, that would happen at this time, or they feel there's an expectation that their mood should be good. But people are as likely to become depressed in that period as they are afterwards. And also some people who haven't developed depression in that antenatal period, they fear that they're coming up to that after they deliver there's going to be this huge extra risk for depression, and actually they are moving through their pregnancy with that risk for depression. Often they're managing really well with it, and after they deliver, yes, there's other challenges, but there's no increased risk of developing depression in the postnatal period. So really we should probably use the term perinatal depression rather than the term postnatal depression.